When Uma Kotagal came to Cincinnati Children's to complete her fellowship in neonatal care in the 1970s, the department was small, but they were doing big things.
We developed a surfactant a couple of years after I got here, and that changed the life of kids because surfactant now allowed kids to live.
It was a changing time for neonatology. So many premature infants were thriving that Cincinnati Children's built a new nursery.
I had begun to think of the work beyond simply whether I could deliver care to an individual child to what we could do together to contribute for a larger number of children.
And that's how Cincinnati Children's grew from a medical center in a Midwestern town into a pediatric powerhouse. People really began asking how they could improve care and change the outcome together. What started as far back as Dr. Albert Sabin's oral polio vaccine developed in the late 1950s, to the rotavirus vaccine in the early 2000s, to clinical trials going on today for COVID-19, Cincinnati Children set the bar higher for being the best at getting better. In the last 20 years, that's included developing better treatments for bipolar disorder, heart malformations, ADHD related to tobacco exposure, and improving systems and the whole patient experience.
One of the important places we found a good idea was talking to parents.
It started with parents of children with cystic fibrosis who started giving feedback about how to improve. Ever since, we've always had parents at the table who have helped teach us how to provide better care. We also studied other industries to learn about things like safety and flow.
So our secret sauce is really this deep improvement capability that we've built. I think the sense of optimism that we can and should do better, our co-production with patients and families, and a design that we created called Clinical Systems Improvement, where we brought together nurses, physicians, and business leaders to manage large parts of the organization.
We've counted many milestones among our clinical achievements, but we're still a work in progress. We've achieved high U.S. News national rankings. We've reduced harm by more than 80% across the organization. We've improved outcomes for children with chronic illness, but we're not finished. The health of our children is not yet where we need it to be. We're moving out of our buildings into the community to change that. We're working with agencies, schools, and parents. We're looking for more ways to get better
and really transform the entire ecosystem in our community so that all children can thrive.